Lives, intubation is often necessary when a COVID-19 patient is struggling to breathe. And during the pandemic, it's all hands on deck. It can happen in a matter of minutes.
His stats are dropping.
A COVID-19 patient's blood oxygen level plummets.
Their mental status may change. They look visibly air hungry. They could start breathing quicker, faster, getting diaphoretic, which means sweaty, explaining that they are having pain in multiple places.
Sound, how does he sound?
The care team makes quick decisions.
I think we're going to have to intubate him, Dr. Sweeter. Talk to me.
All right, I have some exposure.
Okay, you see the cords?
The airway is stretched open and a plastic tube is inserted. Then air is manually pumped through the tube.
Some of the other nuances we have to blend in are the nuances associated with COVID, making sure that we're decreasing the aerosolization, making sure we can do it with all of this equipment on. It's very, very hot, very hard to breathe under here, hard to hear each other. So those are things that we all need to get very used to. We feel like we're yelling at each other.
When the mechanical ventilator arrives,
we're ready. You ready? Okay.
It's a split-second transition.
Nice, very nice.
This is the simulation lab at Cook County Health. It's where emergency medicine physician Dr. Michelle Sergel has been running drills for hundreds of frontline medical workers and those who don't typically perform intubations but may be called to do so during the pandemic.
We need reinforcements because if the front line gets ill or needs to rest, there needs to be more people that are ready to jump in.
I learned intubation when I was in medical school, and the last time I intubated was over 15 years ago.
Cook County Health hospitalist Dr. Thomas Swader is one of the trainees. He takes care of a range of COVID-19 patients, but for now relies on a critical care team if a patient needs intubation.
One thing that is very, very clear that I've seen is how fast these patients can change. Sometimes I've seen the pattern that for a couple days a patient needs a little more oxygen, a little bit more, 2, 3, 4 liters over the course of a day or two. Then very quickly over hours suddenly is, in complete respiratory failure and needs to go to the ICU.
Not every doctor knows how to intubate. Not every doctor knows these emergency procedures or critical care management. So to get those groups ready to jump in and help the front line, it was very, very important to train some of those people.
The scenarios in the sim lab vary from simple.
Is it going through the cords?
Yeah.
Very good.
To more complicated, often perplexing cases.
It appears to be a pulmonary problem where they just can't get enough air, but the numbers we're seeing on the monitors are things we've never witnessed before in other disease processes, and they're not correlating with the way that the patient looks.
That's why the drills are critical as healthcare providers are learning on the fly when it comes to COVID-19.
It's creating the perfect storm. It's really truly preparing the clinician to land the plane in the proverbial Hudson. So it's really making sure that, God forbid, when you're faced with that horrific nightmare, you've got some muscle memory and some recollection of practicing this with your medical team. It's priceless.
The next phase of training will be on the new simplified ventilators on the way right now.